Thank you guys so much for joining me today. I am here with Commissioner of Health, Dr. Lance Frye. Thanks for being here, Dr. Frye. Colonel Matt Stacy, our hospital surge plan coordinator, and Richie Splitt, who's the president and CEO of the Norman Regional Health System. So thank you so much, Richie, for being here. The continued partnership of our hospitals and our medical professionals across the state is the main reason why our response to COVID-19 is being praised by the federal government as an example for other states. When this virus hit our state back in early March, we had only 1 day of PPE stock, testing capacity that was at the bottom in the country, and we were concerned that our hospitals wouldn't be able to keep up with the demand. Today, I'm excited to say we have months of PPE stockpile. We've tested more than 680,000 Oklahomans. Our total population is just under 4 million. We've tested 680,000 Oklahomans. Remember, you can call 211. We have 80 different sites set up across the state to facilitate those testings. We continue to adapt our hospital plan to provide the most effective response for our state. Our forward planning in the early stages of COVID-19 and our work with the medical community is saving taxpayers money, and more importantly, it's saving lives. When other states were standing up expensive temporary facilities in arenas and convention centers, which in a lot of occasions never saw one patient, we were actually investing in high-quality medical rooms to ensure the best possible care for the long haul in Oklahoma. When this pandemic arrived, Oklahomans were staying on an average in the hospital between 10 to 14 days. Thanks to the work of our medical professionals and the advancements in treatments, that stay is now down to an average of 5 to 8 days in the hospital. Another stat that I love to share with Oklahomans, on March 30th, we had 560 people in the hospital across all the state of Oklahoma. And if you remember the models and the epidemiologists and the predictions at that time, were predicting we would have over 5,000 people in the hospital by mid-April. We issued 30 different executive orders. Oklahomans did their part and slowed the spread and kind of kicked the curve. And we've started reopening on April 24th, and now we're 105 days into our reopening plan. Today, we have 643 people in the hospital, and for the last month, that number has bounced between 550 to about 650 folks in the hospital. Another stat that is important to share with Oklahomans, since June 1st was the day that we were totally reopened, restaurant, bars, without any limits of capacity, churches, everything. So we were fully reopened on June 1st. We have seen, out of all the folks that have tested positive since June 1st, 99.3% recovery rate in Oklahoma. 99.3% of every single case since June 1st, since fully reopened. Under the age of 65, the recovery rate is 99.8%. Under the age of 65, 99.8%. We still have to take this very seriously, take care of our most vulnerable and the folks that are most affected, which is over 65 and people with compromised immune systems. I want to thank Oklahoma hospitals. They have done a tremendous job. Our healthcare professionals, I can't thank them enough for the hard work that they've done to take care of Oklahomans. So they've done great. They also crafted the foundation of our state's surge plan, hospital surge plan, and who have stayed at the table with us, with our Department of Health officials, to continue to modernize this strategy as things change, and we learn more about the effects of this virus. And thank you to Dr. Frye for bringing his decades of experience in the medical field to the State Department of Health. He has done a great job of leading the organization. He's bringing a vision to create long-term stability at the health department and a culture of teamwork and effective partnerships across the state. We just this morning, Dr. Frye and I toured the call center, the contact tracing call center. There's around 450 employees in the health department that are working around the clock 7 days a week to contact people, to see who they've been in contact with, to make sure that we contain the spread. Also important note, they're all Oklahomans. 85% of those contact tracers that we've hired were previously out of work. And did I mention they're all Oklahomans that we got back to work? So if you're looking for a job, the health department is actually still hiring, and we're looking for more contact tracers in the health department. So at this time, I'd like to turn it over to Dr. Frye to give us some updates. Dr. Frye.
Thank you, Governor. When COVID-19 first got to Oklahoma, I just want everyone to remember that we were really in crisis mode. As the governor said, we had very low stockpile of supplies. We did not have in-state testing capacity, and the original modeling showed that they were expecting 30,000 Oklahomans to die. So far to date, we've had 593 fatalities from COVID-19 in Oklahoma. The governor closed non-essential businesses to protect vulnerable populations. We increased the procurement of PPE, we increased in-state testing capacity, and we increased our hospital surge capacity, our bed capacity, in order to slow the spread of the virus, and also to prepare our healthcare system for the inevitable rise in cases that would occur, so that we would have what we needed to take care of those patients at the time. We're very fortunate that we've worked very closely with hospitals around the state, as well as the Oklahoma Hospital Association, from the beginning to craft the hospital surge capacity plan. Our first plan had many parts to it, one of which was increasing rural healthcare access to care. That was done through telemedicine carts that we deployed around the state in key areas in order to improve access to care of specialists for those rural providers. We also asked hospitals to submit plans on how they could, their own surge plans where they could increase their capacity. We asked them to increase by 40% because we were expecting every hospital in the state of Oklahoma to be over capacity. Thirdly, we developed specific COVID hospital units in order to reserve beds specifically for COVID patients above the normal capacity that those hospitals had. We also developed alternate care site plans with the Army Corps of Engineers to where we had the ability to build some of those alternate care sites for additional beds if needed. Thankfully, we did not ever need to use that capacity. The original hospital surge plan was built on modeling that every hospital in Oklahoma would be over capacity. Again, fortunately, to date, we've not had to have to use that capacity. As we opened back up our economy and moved to a phased reopening, we inevitably saw that rise in cases that we had expected, and this is obviously due to increased mobility, mobilization, socialization, and people just getting back to their normal lives. Oklahoma's hospitals have remained within capacity, and our public health professionals have identified hotspots of areas of concern rather than being every hospital in the state overrun. Currently, those hotspots are our metro regions in Tulsa and Oklahoma City. Since the demand has changed since we first crafted this plan, we went back and adapted our plan. So I'm going to turn it over to Lieutenant Colonel Matt Stacy at this time. He was responsible for leading efforts in developing the original surge plan and also in this following plan. So Matt, can you come talk to us?
Thank you, Dr. Frye, Governor. Appreciate it. Again, good morning, everyone. My name is Matt Stacy, and as Dr. Frye mentioned, I have been working with the Oklahoma State Health Department, Department of Health, and our trusted partners throughout the period of this pandemic. We worked I worked first on my role on the Governor's Solution Task Force as the head of military intelligence for the Oklahoma Army National Guard, and subsequently have moved on to assist the health department in a consultant role in developing this surge plan. Now, this surge plan is developed as we've learned more about COVID-19 and how it impacts our population and more importantly, how our hospital system functions in a pandemic. So we were able to observe the immediate capacity that was created whenever we canceled elective surgeries, but we also understood the challenges that created challenges from a community health standpoint, staffing, and from a hospital's economic viability. So in an effort to improve on that response and move to a more regional approach, we already have established a regional health network throughout the state of Oklahoma. And that's used by the Oklahoma Office of Homeland Security and the Oklahoma State Department of Health through our regional medical response system and those internal regional healthcare coalitions that are a part of that. So as you have reported and are able to observe on the Oklahoma State Department of Health website, there are COVID positive patients in all 8 regions of Oklahoma. As Governor said, as of today, we have 643 COVID positive patients that are hospitalized, COVID positive or COVID suspected. Additionally, all regions throughout the state have ICU beds, they have ventilators, and they have the ability to care for COVID patients. Now, a persistent goal of our surge planning that's rooted in well-founded healthcare principles is that we need to treat patients as close to home as possible. So therefore, hospitals in the non-metro regions, the areas where we haven't seen as much of a surge, are going to continue to treat patients within their home region as appropriate. And then where needed, they will transfer those patients out of their region to a higher level of care in one of the 2 metro areas. So recognizing that a large majority of our hospitalizations are still confined within the metro areas, we went through a collaborative effort with the Oklahoma Hospital Association, the hospital CEOs, and exhaustive work to develop a region-specific progressive surge plan specifically focused on these 2 major metro areas. And those major areas are what we consider on the healthcare preparedness region as Region 7, which is Tulsa, and Region 8, which is Oklahoma City metro area. Those hospitals in those areas will continue to care for COVID and non-COVID patients up to 100% of their staff capacity. This ensures community health doesn't suffer as we also manage the flow of COVID patients. Now, upon reaching 100% of staff capacity, those Region 7 and 8 hospitals, they will expand, and they're going to provide up to an additional 340 dedicated beds. Now, this consists of 125 beds in the Tulsa metro region. Those beds are located at the Oklahoma State University Medical Center. And then 120 beds within Oklahoma City metro spread across 6 participating hospitals. And those hospitals are Norman Regional, St. Anthony, OU Medical, Mercy, Integris, and Alliance Health Midwest. Now, additionally, through our earlier surge planning efforts, we secured the option to place an additional 95 COVID patients at Integris Medical Center's Portland campus, should we elect to do so. That totals up 340 additional beds on top of what we are already able to support. So finally, through a revised tier approach, the hospitals are also going to implement internal strategies to create additional capacity. And here to discuss those internal efforts and expand upon the exceptional unified front that the hospitals have joined together with the state to develop this plan is Richie Splitt. Richie Splitt's the president and CEO of Norman Regional Hospital System, which technically, if you look at the earlier map, is in Region 6, but he's still part of this expanded capacity plan. Richie.
Thank you, Lieutenant Colonel Stacy. I wish to express my appreciation to you and Dr. Frye, to the Oklahoma State Department of Health, and to Governor Stitt and his team for staying connected to healthcare leaders across the state during this very trying time. So thank you for your efforts to make that happen. It's important that we continue to work together collaboratively to address this public health challenge, and Norman Regional Health System is honored to be a part of that solution. And I believe it's important that I begin my comments by addressing what is hospital bed capacity. Hospital bed capacity can be defined in 2 ways. One, it is about the number of beds constructed in a hospital. How many rooms and beds do you have possible in your facility? The second is it can refer also to the number of staffed beds. How many caregivers and or care team do you have available to care for patients immediately? So for us, bed capacity all across the nation, bed capacity varies from hospital to hospital, and it even differs from day to day. And because of that fluctuation, hospital leaders work very hard to prevent patient flow problems before they arise. We use internal data and we proactively plan patient throughput, patient placement each and every day. We strive to anticipate possible patient bottlenecks and we coordinate discharge activity on a daily basis and often multiple times throughout the day. Using internal data and other real-time information, we continually manage patient flow. We prepare for the day at hand and we prepare for the days ahead. That same proactive planning has and will continue occurring for the state's COVID surge plan that you've heard about this morning. Our surge plan is a distributed model of care as described by Lieutenant Colonel Stacy. It is a number of hospitals across the region that allows us to address patient care needs and keep those patients closer to their homes and to their families should they need to be admitted for care. In the event that patient is hospitalized, they will continue to receive that safe and high-quality care, and again, allow us to spread that surge across our very capable hospitals. As I referred to earlier, our COVID surge plan is based upon each facility's staffed beds. So we have the ability at Norman Regional, we've designated 20 COVID-19 patient beds should the need arise. When our facility and any of the other facilities reach 100% capacity, COVID patients will be placed into specified reserved beds, if you will, and hospital leadership will immediately begin planning, implementing other strategies to maintain patient flow, patient throughput, and will work to create additional capacity as needed. Again, similar to what we do each and every day, we will just be doing the same thing for any potential COVID patients. If these 6 hospitals, health systems in the greater Oklahoma City metropolitan area are overwhelmed somehow, additional capacity can and will be created by utilizing specialty hospitals and the Army Corps of Engineers. So this plan is comprehensive. It allows us to flex up and down according to needs. And Norman Regional Health System is truly a regional health system, and we're honored to partner with the state, with the governor's team and all, to inspire health and to continue to serve all Oklahomans through this very trying time. Thank you.
Just some closing comments for everyone. It's just been an honor really to work with Oklahomans through this pandemic. It's the partnerships that we've gotten with our public and private partners, working with the state departments as well, has been just really amazing. Everyone's come together. We've been able to really have significant impact in the state of Oklahoma with our COVID response. It's one that we've received accolades on and discussions about trying to develop a plan in rural Oklahoma that can be used as a plan across the nation. And very excited about that. And thank you, Richie, for that. Thank you, Matt, for your help. And we appreciate everything you've done. Governor, you have any additional comments?
So thank you, Dr. Frye. Every week, my team and I, we meet with Vice President Pence, members of the White House task force to talk about the nation's COVID response. So Dr. Birx and Fauci and the president's team is on there. I'm really looking forward to Dr. Deborah Birx visiting Oklahoma in the coming weeks. She's making some stops in Iowa and a few other states, and so we've invited her to Oklahoma. We look forward to showing her the innovative partnerships with our regional hospitals as well as our state's strategic efforts to support our rural communities with telemedicine and our COVID-19 strike force teams. And just as a reminder, this marks our 105th day of reopening. And we've been fully reopened. Our phase 3 started 67 days ago on June 1st, more than 2 months. A number of our schools are starting back in person this week. And I want to thank those teachers, support staff, the support workers, the administrators, who are working hard to make sure our kids are able to return to school safely. I believe having the option to attend school in person is essential for so many reasons. And I look forward to continue to support our teachers and our schools as they innovate to provide that valuable, essential instruction in person all across the state of Oklahoma. So as a reminder to parents, as you're getting your kids ready for school, remind them to continue to practice the 3 W's, wash your hands, watch your distance, and wear a mask if you can't socially distance. And we'll open it up to a few questions now.
Week or whenever it is, I guess 2 questions. One, did you invite her to come to Oklahoma? If so, why? And then will you follow any recommendations that she brings to Oklahoma?
So we're, I don't know exactly whether we extended the invitation or she called us and said she was going to be in Iowa and wanted to make a trip. So we're in contact with her team, what all she wants to see in the state of Oklahoma. Looking forward to those discussions. Again, we meet with her via Zoom calls once a week or twice a week today. And we've done a really good job of looking at all their recommendations. So I'm looking forward to having her in the state, showing her what we've done, trying to figure out what best practices are across the state and what she's seen in other states work well.
Is that just people that have not died from the virus, and does that account for those with lingering effects from the virus?
So that stat is just the number that I quoted earlier was the number of cases since June 1st divided by the number of deaths. And that is a percentage. Instead of saying a death percentage, which was 0.7%, the recovery was 99.3%. And then I gave the under 65 numbers as well. We didn't back out anybody that's in their 14-day period or anything like that. Because there's always a tail on the front end and the back end, and so we just took the dates from June 1st on.
Governor, we're starting to see a problem in Tulsa County when it comes to testing. A lot of people are waiting 4 days to just get a slot, and then some places are not getting results back until 10 days. It seems like some people will recover from COVID before they know they have COVID, and we're not testing on the weekends. How do we deal with that problem moving forward?
Yes, let me have Dr. Frye address the testing.
Sure. Fortunately and unfortunately, there are a lot of different labs that are being used. And we look at those. I don't have that stats with me right now, but if you use some of the labs that we are contracted with, we put in our contract that they have to report back to us within 48 hours. So we get those back pretty quickly, but there are a lot of different labs. I mean, people can go to a CVS or a Walmart or anywhere to get, and so we can't control the ones that are in private sector. They're sent out to other places as far as the turnaround times. And some of those are sent out of state. I've heard some people saying that they've had to wait 14 days for a lab result. And that's difficult. It is. Unfortunately, the only way we can help that is by really increasing our in-state capacity, and that's what we've been continually building on. And I know Secretary Pollard is working on that as well and has done a really great job with that. But we've increased our in-state capacity from really about 100 tests a day to about 5,000 so far, and are continuing with plans to continue to increase that.
Just to follow up on that, we're not testing on the weekends in Tulsa County. I don't know how it is with every other part of the state. Is it time to start testing on the weekends to help make up that slack?
It's a good question. I know that there are some places available to get tests. They may not be at the swab pods that are set up, but people can still go get tests at certain places. But that's something to look into. I haven't looked into the stats on that.
Do you know how many surge beds there are being used in Tulsa, and how long does it take to get them staffed?
I don't know how many are being used at this present time. I know that they have used some of them in the past, but I'm not sure how many are being used at this moment.
Colonel, to follow up on the testing question real quick, it kind of hit home for you. It was reported that your father had gotten tested and it was 20 days out and he hadn't gotten the results yet. As governor, you hear these things, we ask you these things, and you're pretty cool and calm and collected. What was your reaction when you found out that the state medical facility that, I think wanted a sales tax exemption from you, that they took a test and it was 20 days until your father could get a result?
Well, first off, my parents got tested, and you probably saw there was a news article about it, and my parents did get their test results. It was buried inside an email. They were negative, and so my parents are 75 years old, and like a lot of people, we need to do a better job of reaching out and calling those folks. And so they didn't realize that they had the test results. So they did get notified in a more reasonable manner. So I know the news report or whatever said 20 days. That was not accurate.
Oh, thank you. I appreciate that. And then, apologies to OU Medicine, right? It wasn't me that wrote it. Quickly following up, either you, Frye, both of you, gentlemen, you mentioned the modeling from the spring, and it was off, thankfully, I think. What does the modeling show now? We see what the rolling averages are. We get these reports every day. That's going up. It went down a little bit today in terms of the rolling average. What does the modeling show now, and what are you guys anticipating over the next month to 4 months?
As you mentioned, the previous modeling, one thing I can say about all the modeling that we've seen so far is none of it's really been very accurate. Unfortunately, we wish we had better modeling to give us something to hang our hat on or really to plan or follow for. But we have been doing some modeling looking at hospitalizations, and it's been pretty stable with the modeling. We're basing that off of the number of positive cases that come in today, breaking that down into the percentage that are in each age group, and then the percentage of those people that would normally end up in a hospital, and then the average length of stay for those people, and looking at that. And it's been sticking right around the 600s, and it's for what we can see right now, it looks like it's going to stay there. Again, this is very unpredictable. We do have increased cases in the state of Oklahoma. We do have some increased hospitalizations in the state of Oklahoma. The good news is the percentage of those positive people that end up hospitalized has decreased over time.
Colonel Frye, would you say that either the rolling average or the daily average has plateaued?
I think it's too early to say whether it's plateaued or not. We had seen, there's different things to look at. If you're looking at hospitalizations, we seem pretty stable right now. If you're looking at the number of cases, I think it's a little too early for me to say that. One of the things that makes that difficult is the fact that we have a delay in reporting of those cases. That's based just on the logistics of somebody getting a test, it being sent to a lab, that lab processing that test, and then getting that result back to us. Then we have to take that test and we have to put it in our system to make sure that it's not a repeat test, so that it's a unique new case, and that person actually lives in the state of Oklahoma, and some other things that go along with that just to confirm that it's actually a real new case. And that way we can start contact tracing all the things we do. So those things take some time, so it's never real time. When we look back at our recent numbers, we look at it every day, and about 85 to 88% of those are the date the specimen was taken was within the last 2 weeks when we received those tests. So it's hard to really look at those and try to figure out where a plateau is. And you'll have an increase one day, a decrease the next. So that's why we do the 7-day average on those.
Sorry.
Governor, you briefly mentioned earlier Dr. Bricks's visit, but have you gotten any guidance from the White House exactly why she wanted to make this in-person visit, even though y'all do speak with her virtually every week, and kind of what she wants to see while she's here?
Yeah, we haven't. I don't know if my team has, but at this point, they haven't briefed me on what she wants to visit. So we plan on taking a tour of some of our surge, kind of walking her through our plans, walking her through our numbers. I assume, she's on the White House task force, so she's visiting Iowa. She's been in Arizona. She's been in New Mexico. She's toured Florida. she's, been all over, and so California, and so I think she's just going to be in the region, and we're excited to have her here. And just, I want to speak to your question. When you talk about a plateau, if we have 560 hospital beds and folks being treated for COVID on March 30th, and we're at 643 today, you can graph that however you want, but we have been bouncing between this number of 550 to 650. And so, and then we had 843 positive cases today. I think we hit probably 843 cases 3 or 4 weeks ago was probably the first time we went over 800. So we have not seen the exponential growth that some folks predicted, and we've been kind of in this nice band here for the last 3 weeks or so.
Oklahoma City has a mask mandate. The capital is clearly in Oklahoma City. Is that mandate being enforced in the state capitol and in state office buildings?
Yeah, I don't think the mask mandate's been is enforced in state buildings. I think that's kind of the rule.
Commissioner, we've heard from more and more health experts, doctors. I was talking to Dr. Bratzler at OU-Med yesterday about the possibility of a statewide mask requirement instead of doing it piecemeal by city. He said he's especially concerned of that going into school this fall. What is your recommendation to the governor on a statewide mask rule? What has your counsel been to him on that?
I think a statewide rule is very difficult in a state like Oklahoma. We have such a diverse population. We have very rural areas and we have metro areas. So, someone in a rural city doing the same activity in a metro region is far different. So in a state that's this diverse, I agree with wearing masks. I think that's appropriate. I think it's a good thing for everyone to do, to take personal responsibility and social responsibility, but to mandate it in such a diverse state is very difficult.
Commissioner, gotcha. You talked about contact tracing today. Can you tell me what percentage of people who test positive are being reached out to by contact tracers?
We're trying to reach out to every one of them. I don't know the exact number at this time, but we try to reach every one of them. When it comes through our system, we've recently upgraded our system to a MTX platform with the ability for that to be done on a more automated basis. Before it was spreadsheets and pieces of paper. Now it's all automated.
What are you?
Are you concerned that kids going back to school you're gonna see a spike in the positive tests?
I am concerned. I mean, I'm always concerned about any place with any large gathering of people, but I'm also understanding that children need to be back in school, and the studies have shown so far that children under the age of 10 don't spread the disease like adults do. And so there are some nuances to it and things that need to be worked out.
Governor, have you asked the congressional delegation for any aid in this new bill being considered? The HEROES Act, I think is what it's called. Do we need anything from Congress specifically?
We've told the White House, our federal delegation, that we would not. I don't think we need another stimulus package. No, and so we've told our federal delegation, we've told the White House that we're more concerned. We want to make sure that this $1.2 billion actually gets on target. And we have not even got our $1.2 billion that we've spent or that we've been allocated so far in Oklahoma. We haven't got it out. And so our message back to the White House was, before we go to the well and do another $2 trillion bailout, let's get these monies out the door first. And that's something I know that those guys are working on. And if it happens, great. But I'm not gonna count on those dollars until we see them. And I want to make sure that our 1.2 gets out in an appropriate manner, and that's why we set up all the programs that we did. We did $10 million for schools. We asked the Department of Education what they needed, and we got that out for PPE. We set up $100 million for the business relief program. We got that out. We put $20 million to minority-owned businesses. We did some money to our, we did $15 million. You guys might have remember the Hope Community Plan, the Boys and Girls Clubs across the state to help with some of those school children that aren't going back to school. We wanted to be able to set that up. Just a number of different things. We also just allocated $250 million to pro rata to different cities and municipalities across the state. But those monies haven't even got out the door yet, so we have till December 31st. If there's something that needs to happen later on, then I'm sure our federal delegation will work on that.
Governor, real quick on that, have you been lobbied much by people on how to spend that CARES Act? You've sort of got, got a lot of pizza at the party, and are people asking you for different things? Have you been lobbied much?
No, I have not personally been lobbied much. We set up a bipartisan legislative group to kind of monitor that. It's led by John Budd. His team's done a great job. A lot of stuff that goes into that, but obviously our state agencies, we had to first reimburse every state agency for COVID-related expenses. So obviously a lot of it went to the health department, buying PPE, all that. And then we set up, we kind of had a plan to get that money out across all the different sectors, taking care of our cities and municipalities. And then we still had some left over, so we wanted to get more money to our municipalities. And so that's why we did that $250 million block. So, but I personally haven't been lobbied much. Thanks so much, guys. We'll see y'all next time.